CRTV News, nothing but the news.
Dietitians prescribe a balanced diet. Today is World Press Freedom Day, observed under the theme Journalism Without Fear nor Complacency. In tonight's edition, we plunge into the historical evolution of press freedom in Cameroon for over 3 decades. And the dietitians prescribe balanced diet plus hot drinks and citrus fruits to COVID-19 patients for their healing process. Get experts' views in this newscast. Plus, activities resume at the Yaoundé Public Emergency Center after a 24-hour strike by volunteers for the non-payment of 4-week bonuses. This follows a crisis meeting with center governor, during which government prompt reaction was saluted. And those are top stories. Good evening. Thanks for joining us on this edition of the 7:30 News. I'm Gladys Tata on Anchor. Cameroon joins the rest of the world today to commemorate Press Freedom Day under the theme Journalism Without the Fear of Favor. The day is observed under a special context of a global fight against the COVID-19 pandemic, which poses a new challenge of physical access of pressmen and women to information. Kylian Dandifon paints the picture of press freedom in Cameroon as provided for by the social communication laws of 1990 and the practice on the field. Kylian?
Pressmen acknowledge that the 1990 social communication law is the backbone of press freedom in Cameroon.
The press in Cameroon is free at the level of what newspapers publish, what the journalists say on radio or on TV. When we see the kind of things and listen to what journalists in Cameroon say about state officials and they go away with, we can say that the press is free in Cameroon, at least at that level.
Some of them even accept that there is a high degree of tolerable anarchy.
The head of state of this country is the most insulted, but except that my memory is failing me, apart from the case of Njawe, the late Njawe, we don't know of any journalist who has been arrested because he or she criticized or insulted the head of state, but we see them insulting him every day.
But beyond freedom, they have scores to settle with the law which they feel should make libel civil, not criminal.
The law has not provided any binding safety for journalists after expression. That is why in Cameroon, you still find journalists being prosecuted.
We still have criminal charges against journalists. And I speak to you, you have 7 journalists who are in jail, and they have been there for lengthy periods without trial.
To the private press, there is discrimination in promotional opportunities.
Without an information act that will compel authorities, for example, to give information to journalists and make information public, because it is a right of the citizens in our democracy to have reliable information.
In Cameroon, there is an unwritten rule that only the public media should be given access or should be given adverts, whereas the private press can fend on their own.
With a broad landscape of over 600 print media, some 200 radio and 50 television stations, it is more of a jungle situation that compromises so much of professionalism.
Journalists in Cameroon have saluted the advances made as far as press freedom is concerned in Cameroon from the 90s to present-day practice, while maintaining that the road to go for a complete free press is long. They have raised issues like the inability to access sources of information, repression from persons who feel victimized by their reporting, and the 2014 law on terrorism that puts the journalists at a tight corner. Emanuela Vemnioy now narrates the history of press freedom from the 1990s till present day.
Walking the road to press freedom in Cameroon has been hectic, tough for journalists who went beyond what was seen The records of censorship in Cameroon in the 90s show an oppressed media which projected journalists more like enemies of the Republic instead of watchdogs of society that they are. Decades after, the media seems to enjoy relative freedom.
Of course, there is absolute press freedom in Cameroon, but freedom after expression is not guaranteed.
There have been some great improvement. More and more government officials now understand that the public has a right to know, and the fact that the public has a right to know, it is only journalists who can provide that information.
Press freedom is quite a reality in our country, but private press need more means.
With over 600 print media organs, more than 200 radio stations and close to 100 television houses in Cameroon, many qualify this as press freedom and hold more is needed.
We don't have the Freedom of Information Act that will enable journalists to get access to official sources of information. You have the 2014 law on fight against terrorism. These laws are like a sort of Damocles dangling over every critical journalist in Cameroon.
Access to information is quite a very difficult challenge for us, especially practicing within independent media, especially accessing information from government offices.
If the media, which continues to broaden its spectrum, is today creeping under the scourge of suppression, many say the non-respect of the ethics of journalism is to blame.
Journalists shoulder a lot of responsibility as to what is happening because they're not even together. The Cameroon Union of Journalists that was created was countered the next day because people had to step out and create their own.
Sometimes us journalists too, we have part of the blame to share because people are sometimes quoted out of context.
They are sure the journey to inform is on, but however quick to point out the stumbling blocks.
We asked for the amendment of certain provisions of the 1990 law on mass communication. It has not been done. To see who even is a journalist in Cameroon, who qualifies to create a news media organ. We even asked for the creation of a national order of journalists to make sure that the profession is organized, just like the one that lawyers have.
Although Cameroonian journalists are freeborns, practicing their profession will forever entail strings.
Producers and presenters on Sunday TV debate programs say in spite of the confinement imposed as a result of the coronavirus, they will carry on with their shows while respecting preventive measures, with most topics focusing on the COVID-19 pandemic. CRTV's Gerard Nanji Eyambe visited some media channels in Yaoundé on this day observed as World Press Freedom Day.
Even though the narrative has not changed much, most TV debate programs that focus on political issues now give more time talking about the COVID-19 pandemic and its associated challenges. Education on the pandemic and government measures to curb it animates the debate. This new normal in the production of such TV debate programs now witness a change in its methodology.
Wash the hand and take
the measures to fight against COVID-19 is respected in a studio setting. There is a cleaner who ensures that before the guest arrives, cleans and disinfects the studio. Also, the social distancing measures too are respected. The number of guests on set has been reduced to maximum 4 persons.
To the TV program.
La plus grosse difficulté, c'est de constituer le panel.
The main difficulty is how to find the right guest who will be objective. We have more of partisan guests, and it is quite difficult to have a complete set given that experts have disappeared.
Parce que les experts ont quelque peu disparu.
The feedback is felt differently by viewers who have varied appreciation of the content and manner of delivery of the debates.
These thematics help us to have some information about the pandemic.
These Sunday's TV debate programs coincide with the 2020 World Press Freedom Day, observed under the theme, Journalists Without Fear or Favor.
Panel discussions have become a popular genre in the audiovisual landscape in Cameroon. Proximity radio stations and television channels in the country have each created programs in which journalists exchange with guests and experts on topical issues in the country. This has created a new crop of radio and TV personalities in the country. But could this be considered a new form of journalism or shortcut to fame? Joyce Tata attempts an answer.
Almost Almost every FM station and TV channel in Cameroon today has that one leading program during which a journalist questions guests on topical issues. Every channel handles the program in their own manner, sometimes giving the impression of a new form of journalism. But is it?
These persons, we see and hear them on debate, but we can't call it the journalistic genre, because genre refers to something particular and precise.
Issues treated on these platforms are usually delicate, sensational, and sometimes unverifiable. Handling them requires tact.
You have to have a broad knowledge of what is happening within your community, and you have to read widely. You have to be impulsive.
Panel discussions have created a new wave of media personalities in the country, some professional and others gravely unprofessional. It is a format that has its ups and downs.
A tricky one is managing a panel that is going out of hand. It can be your editorial policy doesn't permit it. It could be the ethics doesn't permit it. So you have to be able to manage a situation.
As viewers remain glued to their TV and radio sets following the top debate programs which exist in Cameroon, experts say while celebrating Press Freedom Day, it is important that media professionals always bear in mind the need to serve the public with the right, factual and clear information in a talented manner.
And on to one of our lead stories, some disgruntled volunteers at the Public Health Emergency Operations Center who carried out a peaceful strike action yesterday have called off the strike after receiving payments from the Ministry of Public Health. After a crisis meeting with Center Governor Nasiri Paul Biya, each volunteer received 4 weeks of dues and thanked the Minister of Public Health for responding positively to their preoccupation. Baldwin Sama tells us more.
Queued up on different lines with each holding a photocopy of the ID card with their signatures on them, telling signs on their different faces of a happy end for these volunteers at the Public Health Emergency Operations Center. They will for 1 month have volunteered in different departments here, with most involved with on-the-field sample collection as far as COVID-19 is concerned, expressed their dissatisfaction with what was proposed to them as payments at the end. Governor Nasiri Paul Biya met with these disgruntled volunteers, with whom an agreement was arrived at, with the different lists consulted and verifications carried out. Then it was time for payments.
Everything with instructions from the minister, they are being paid and everybody is happy. We want to say it is a happy end for this problem, which was not supposed to be. They should understand that with a little bit of tact, the problem would have been solved in another way.
Each volunteer received what he or she was due as they thanked public health officials for their timely intervention.
I'm satisfied of the reaction of the minister. I'm very satisfied.
Public Health Minister Dr. Manawuda Malashi, playing the role of a father talking to his children, thanks them for the great work for the past 1 month, expressing his ministry's readiness for constant collaboration to stop the spread of COVID-19.
The government of Cameroon does not only offer free treatment to COVID-19 patients, but equally takes full responsibility of their feeding. 3 square meals plus dessert are offered per day to these patients. A team made up of professional caterers supply over 600 plates of a well-balanced diet to COVID-19 patients in Yaoundé. Constantine Bomb visited one of the spots where the food is prepared daily and now reports.
Access to this kitchen is strictly prohibited because the cooks are preparing food under special conditions for COVID patients. Ever since COVID-19 cases were recorded in Cameroon, these cooks have been on their feet, cooking for patients quarantined. 30 square meals are provided daily, offered by the state.
All has to be done for us not to be the one to worsen the situation. Everything is done for the food to respect all conditions of hygiene. Today we can have 80%, tomorrow we may have 20%. The first days we had like 100%, and for these 100%, we had to use like 600 boxes for food because they have the breakfast, they have the lunch, and they have the dinner. And the dinner, lunch and dinner are made of hot plate and dessert.
Being creative, making sure COVID patients have a balanced diet of Cameroonian cuisine comes with a big challenge.
We try to provide food so that the people sick have a balanced diet. We also have people on diabetic. So for them, we try to make our best to bring food without oil, without salt, try to make it tasty. We try to make things joyful so that it makes you want to eat it.
What gives them hope every day is news on recovered cases, as it reduces their workload.
My staff have been on work since the beginning. We work every day, every weekend, to try to bring the best of Cameroon food. At the beginning, we had a lot of foreigners, but the foreigners have left. So now we mostly have Cameroon people. So we try to have them visit Cameroon through the food.
They have a very challenging mission to complete every day, as feeding COVID patients is not easy. Everything is done with strict respect of safety measures, such as wearing of gloves to avoid any hand contact with the food. The appetizing food is free, but I'm sure no Cameroonian will enjoy eating free food in a quarantine condition. If you really don't like the condition, then respect the barrier measures to be safe.
COVID-19 patients are enjoined to meticulously practice a healthy and balanced diet, a requirement for good health. In the meantime, some of them have been advised to consume hot drinks and citrus fruits if necessary, given its nutritive values. Romeo Kenye spoke to some dietitians and put together this report.
Citrus fruits and hot drinks are recommended for a majority of coronavirus patients, given its diverse nutritive content, dietitians say.
The citrus fruits are rich in, first of all, they are rich in sugar, they are rich in fiber, and then they are very rich in vitamin C, which is one of the main reasons why they are being propagated during this period. Apart from that, they are also rich in other vitamins, like the vitamins of the B group, necessary to metabolize macronutrients like fats, carbohydrates, and sugars. And then they are rich in some cell mineral salts like magnesium, like potassium, like phosphorus, and copper.
The consumption of these fruits and drinks should be done with the help of medics, as the quantity also matters.
Lemon, pineapple, mango, carrots.
Taking hot drinks in case of COVID-19 will help liberate the nasal canal and reduce inflammation in the throat. And also, taking citrus fruits will help improve on the vitamin C content of their main meal.
Infected persons are expected to live on a healthy and balanced diet, regarded as a prerequisite for good health.
As of now, Cameroon has registered more than 60 deaths as a result of the coronavirus. But the way those who die of COVID-19 are buried is yet to be accepted by many in the Cameroonian society. The notion of a befitting burial, typical of most African societies, is absent, talk less of the cause of the death, which is known by all. Do COVID-19 patients deserve respect or have a right to a medical secret? And why do communities find it hard to accept this new way of burial? Beatrice Ngom went out finding for CRTV News.
There is pain when one dies in Africa, but it is even more painful when families cannot bury their dead. COVID-19 has imposed a new way of life for the dead.
People are buried immediately after they die. There are specialists in burying because there are purification rites that they have to perform to make sure that others are not affected with the same disease.
Cultural adaptation is difficult. This because the cultures of ethnic groups on the belief in the dead vary.
The Bamileke, for example, when somebody dies and is buried, after some time, they go back, dig the grave, remove the skull.
So, communities need to be prepared to accept this new culture of burial, which is as a response to COVID-19.
Those who dig the grave and remove the skulls, there will be an issue there. We just need to involve communities in decision making.
Medics too insist ethics and deontology during treatment is respected, but the restrictions around the patients are enough to raise suspicions.
It is not the doctor who makes the death of a COVID victim public. The management of cases is enough to raise suspicion. The public sees a doctor dressed like an astronaut, a patient wearing a mask. You need not tell them it's COVID-19.
The medical corps says it's trying hard to bury victims with minimum of dignity.
This diseased person is also buried with respect of the individual dignity as well as culture, in the presence of a family member, a pastor, an imam, or even a reverend father.
Families wishing to exhume the corpse can only do so after 3 years, the authorized time for persons who die of infectious diseases.
And let's now take you over to the Public Health Emergency Operations Center here in Yaoundé to join our reporter Baldwin Sama with our daily updates on the spread of the COVID-19 in the country. He is with Dr. Eric Tandy. Good evening, Baldwin. Tell us, what are the latest updates from the center?
Good evening to you, Gladys, and welcome to the Public Health Emergency Operations Center this Sunday evening, where I should say that we have not had any new case of recovery from COVID-19 in Cameroon this Sunday evening. I should say for the last 48 hours, no new case of recovery has been recorded here at the Public Health Emergency Operations Center. As we said the other day, these figures are dynamic and they can change at any time because officials of the Ministry of Public Health keep receiving files from the different regions of the country here at the Public Health Emergency Center, and they will keep on updating Cameroonians. And tonight with our resource person, Dr. Eric Tandy, we shall be looking at the choice of the doctor who takes care of COVID-19 patients in Cameroon. Good evening, doctor.
Yeah, good evening, Baldwin.
Tell us what type of a doctor takes care of COVID-19 patients, or how are such doctors selected?
Yeah, it is important to note here that it's a whole package. It's not only the medical doctors that handle COVID-19 cases, because there is a complete package involving psychological personnel, mental health personnel, nutritionists, and again, I should make mention here that this is based on cases, you know, with various conditions based on the patient. Then we can orientate a specific specialist that can handle. So it's a complete package. It's not only oriented towards a single group of medics, because in the medical corps we have so many persons. There are nurses, there are lab technicians, so it's a whole package.
Are all of them given the same treatment?
Based on treatment, treatment will be based on individual situation, how the situation involved. But remember, there is a protocol that is being followed. But then there are associated complications based on individual conditions. So if your condition is not the simple one, then we'll need to associate with more treatment.
What about the situation, for example, where an individual has symptoms of COVID-19 and finds himself in a faraway locality like Fuawa, somewhere in the northwest region, where we are told there were no test kits there? How is such a case handled?
But you know, in the communities, based on decentralization, the health system is very organized, where we have even community health workers that have been trained. And again, medical personnel in the community have been reinforced, their capacity have been reinforced in a way that they could identify suspected cases. And once these suspected cases are identified, there is a way of transporting them to where their samples will be collected and analyzed. So it's not just a matter of where you are, irrespective, even if you are in Furawa or in Kolofata, there is already somebody ready. The only thing you need to do is to inform the health personnel that are on the ground, and you will be oriented. But remember, you have to stay under a mask, because the face mask is like the prerequisite condition to stay safe.
Thank you so much, Doc, for always being available on the 7:30 p.m. newscast. And on this day, we are talking about Press Freedom Day. Officials of the Ministry of Public Health use the opportunity to appreciate the key role played by the media, especially CRTV, talking about sensitizing the population on some of the measures to adopt to avoid the spread of COVID-19 in Cameroon. As they say, their main aim remains to save as many lives as possible. They will continue dedicating so much time, they will continue putting in so much effort in this fight against the spread of COVID-19. So the take-home message from here is no new case of recovery recorded here. Over to you, Gladys.
Thank you very much, Baldwin Sama, and see you next week. The government has taken certain measures to caution the harsh effects on the business sector as a result of preventive measures put in place to halt the spread of the coronavirus pandemic. In the following write-up, Luma Slim Davis says the measures, which include debt reschedule for enterprises, will help boost economic sector.
While the restrictive measures taken by government to fight against the spread of the coronavirus pandemic was laudable, it caused a slowdown in economic and financial activities. The government has now removed barriers to allow bars and leisure sports to operate fully, amongst other measures.
I think that the activities of our economy will go ahead with those measures. I think that is very good for all the population of Cameroon.
With many Cameroonians living on daily businesses, such as taxi drivers and those engaged in petty trading, the cancellation of parking fees as well as other market fees will no doubt help maintain some financial stability for these economic operators.
The government is in the period of observation. This period will permit the government to improve the conditions of the enterprises and population.
Perhaps the most appreciated of these government relief measures is the debt reschedulement for enterprises. This is a welcome financial breather.
The fight against the coronavirus has received a boost in the southwest region with the arrival of another set of sanitary material and other items offered by the head of state. The items, which have been presented to Southwest Governor Bernard Okalia-Bilai, are ready to be distributed to health personnel and to the population, as Charles Abuno tells us from CRTV Southwest.
This particular set of the presidential donation for the Southwest within the context of the fight against the COVID-19 consists of testing kits, protective kits, hand sanitizers, disinfectants and liquid soap. Most of these would be distributed to health personnel in the region. These materials are meant to improve on their level of protection, taking into account how exposed they are to the disease. There are other items such as rice, milk and beverages, among other foodstuff. These are to be distributed to internally displaced people as soon as possible, as ordered by Governor Bernard Okalia-Bilai. The Chief Executive Officer of the Southwest is appealing to the population to be vigilant and responsible despite the relaxation of some of the anti-COVID-19 measures by the government.
All the individuals, let us continue to observe a responsible behavior to accompany this initiative with patriotism and love to our population.
According to administrative authorities in the Southwest, more items are expected to arrive this region in the days ahead.
The Presidential Special Package to prevent COVID-19 in Mezam Division have been handed over to the 7 divisional officers by the Senior Divisional Officer, Simon Emile Mo. He urged the administrators to be transparent in the distribution exercise in a bid to curb the spread of the virus in their respective localities. Mesode Metuge completes that report from Bamenda.
The consignment from President Paul Biya to help prevent the spread of the pandemic in the Mezam division comprises of hygienic products like hand sanitizers, savon and buckets. Handing over the COVID-19 kits to the divisional officers of the 7 subdivisions of the Mezam, the senior divisional officer insisted on the effectiveness of the distribution in the different localities.
This will be shared through a local committee because I've signed a prefectural order fixing the modality of distribution of this special gift.
We permit them to respect the governmental measure taken in order to fight against the coronavirus.
The head of state's gift is expected to roll back the spread of the COVID-19 in the Mezam division.
Personnel of the 10th Military Health Sector in the Southwest region have been equipped with skills to communicate and prevent the spread of the coronavirus in the military barracks. This was during a capacity-building workshop organized by the Ministry of Defense in Boya, as you tell us, Tanjong Levis Agbo from CRTV Southwest.
Health personnel in Cameroon have been carrying out a vital role in the fight against the coronavirus, and so the military health sector in the Southwest region has not been left out. The capacity building workshop was aimed at sensitizing the soldiers on the prevention of the virus and how they should communicate with the local population and their colleagues at the barracks.
This pandemic will weaken the armed forces, will affect all our actions. So our hierarchy, the Ministry of Defense, instructed us to capacitate our personnel concerning this disease so that we should block the spread of this disease among the barracks.
With the help of health facilitators from the Southwest Regional Delegation of Public Health, they had practical sessions on how to disinfect the environment, active case search, contact tracing and clinical management, which according to the participants will help them fight the coronavirus.
I've learned that the method using in order to transmit these messages to the population, we need serious way on convincing them, like for them to know that protecting yourself with either the mask or washing their hands, it is not only for their own benefit, but it's a benefit for their loved ones and the population as a whole. Thank you.
While applauding the efforts of military personnel in the Southwest region, the soldiers were reminded of their role of protecting the population from the coronavirus while staying safe.
We stay in the Southwest region, where the Vice-Chancellor of the University of Boya has challenged newly appointed directors and deans of the University of Boya to be diligent and assiduous in fostering excellence at the institution. Professor Horace Ngomo Manga was speaking during the installation of the officials at the Dorothy Njema Amphitheatre. Here is Andebel Ndige Enonyang with the details from CRTV Southwest in Boya.
The 4 newly appointed officials at the University of Boya includes Professor Pius Mbu Obeng, Director of Academic Affairs, Professor Sakwe George Mbutake, Director of the Advanced School of Translation and Interpretation, Professor Gregory Haller Ekane, Dean of the Faculty of Health Sciences, and Professor Mvondo Awono Jean-Pierre, Dean of the Faculty of Agriculture and Veterinary Medicines. These scholars, embedded with rich and diverse educational background and skills, were installed by the Vice-Chancellor, Professor Ngomo Manga, who congratulated them for their new tasks. Professor Ngomo also saluted the laudable work of their predecessors and challenged the newly administrators to be diligent in their various responsibilities.
We expect them to bring a new dynamism into their positions, into their jobs.
Meanwhile, some of the newly installed officials are optimistic in bringing innovations at your various faculties.
We are going to do all we can to make sure that we revamp and even put on a greater gear the training of translators and bilingual specialists.
To give visibility to the faculty. And this can be done mainly by inter-university collaboration.
Despite the challenges faced by the ongoing COVID-19 pandemic, the newly installed officials have the daunting task of impacting and facilitating excellent results in the university.
And it is on this report from the Southwest region that we draw the curtains on the 7:30 edition of the news. And join Karine Olivia Bit at 8:30 for the news in French. You'll be in the company of Esther Kima as from Friday. Until then, it's bye from all of us on the 7:30 crew. Have a pleasant week.
CRTV News, ici, toute l'info.